So we're not going to cut in half. We're going to get the medial line. You okay? Okay. So this is the width of the tape. Okay, just come up close. Come up close. Okay, so this is the middle of the tape. If you cut in the middle, it's going to be 2 strips, 4 strips, 6 strips, 8 strips. But we want to cut 5 strips. How do you cut 5 strips? So you get the middle line, and then you go to one side, 1/2 centimeter. And then this becomes 2, and this becomes 3. You cut in the middle, so it becomes 1 and 1. Then here, you go to 1 centimeter to one side, leaving 2, and you cut in half, okay? So in this way, we're dividing the tape into 5 strips. Okay. So we're going to get the first strip, and you start cutting straight, okay? Okay, so I want you all to do the practice of this application on the hand, because the hand is a very important treatment for neurological conditions. Okay? There are more receptors at foot level or at the hand level. More receptors at the foot or on the hand. Hand. Okay. Clean your hand on both sides. Oh, I'm going to try this side. Okay. Okay. You want to do a chrono? How many seconds? Okay. Ready? Tell me how many seconds. Okay. Ready? Okay. Ready? Set. Go. Okay, so we want to do it in 40 seconds. Okay, relax, don't forget to breathe. Okay. Make sure it's straight. Okay. Which means if you are spending 10 minutes just to cut the tape, when you go working and your employer sees you spending 10 minutes just to cut the tape, you're going to say, how many patients are you going to see in 1 hour? Okay? Or when you're working by yourself in your clinic, okay, so you're not going to be wasting time. You have to cut. And so it's just a question of experience. Okay, so we have 5 strips, extensors, 5 strips, flexors. Okay? Okay. Close fish, both sides. Okay. Open, close. Open, close. Coordination. Okay. Thumb, index finger, and the other finger. Okay. Okay. So let's start on the extensors. We always start on the extensors. Okay, so just follow. Okay, so we put the arm into a triple flex position, elbow, wrist, and fingers. Okay, and so we apply the tape at the base of the fingernail, Okay, in flexion. Take off the paper, 10 centimeters, fold, clench fist, Okay, clenched fist means the skin is stretched or not stretched? Stretched. And so we apply the tape, zero tension, over the dorsal aspect of the finger. Okay? And then stick. Stand. Wrinkles. Close. Then get fist in fist. Fist in fist is like this. Okay? With your patient, you have to do it like this. Elbow extension, wrist flexion, and fist in fist. Okay? And take off the paper, and get the strip, and you apply the tape directly over the extensor of the index finger, going towards the epicondyle. Okay. So when he extends, okay, just like this, you will see in a neutral position, the tape wrinkles. Okay, next one, triple flexed position like this. Okay. Apply the tape at the base of the fingernail, 10 centimeters, clench fist, no tension, stick, fist in fist, elbow extended, wrist flexion. Okay, zero tension. Oh, and this one's shorter. How come? This one is shorter. How come? Oh, that's right. Okay, so it has to be shorter. Okay, next one. Okay, zero tension. Fist in fist, elbow extension, wrist flexion. Okay. You apply one tape on top of another, becomes compression. Okay. You apply the tape really close to the other one, becomes also compression. So we have to apply the tape, keeping a certain distance from one tape to the other. Okay, distance. This one is longer, because the finger is shorter. Yeah. Okay. Next one. Okay. Triple flex position. Apply the tape. Zero tension. Okay. Just like this. Okay, so this is what we should have applied on the child yesterday. Okay. Becomes a little bit difficult. Okay. Zero tension. Make sure that the tape is applied with zero tension. And so you see here, okay, just relax. Okay, and so you see, okay, how the tape is wrinkling and the activation is like this. Okay, okay. Just do some movement. So this one. Okay. Which one has more mobility? Okay, now we go on to the thumb. Okay, so the elbow extension, wrist in, ulnar deviation, no flexion, ulnar deviation, triple flexion of the thumb. First flexion, second flexion, third. Triple flexion. It's not like this, it's like this. Ulnar deviation. No. No. Like this. No. Like this. Someone help her. She's doing like this. Just ulnar. Yeah, triple flexion of the thumb. No. Okay, so at the base of the fingernail, take off half the paper, half, triple flexion, and to apply the tape, zero tension. You have to center 3 joints, 1 joint, 2 joints, 3 joints, okay? And you're going to go towards the lateral epicondyle, okay? Just like that, okay? So this is a technique for the 5 extensors, okay? So you see the thumb, like this, okay? And each one of the fingers, okay? Let's do some movement. Okay, also the other one. Activation, yeah? Activation. Okay. Clenched fist, both sides. Which one is more clenched? Yeah, this one is even more clenched, yeah? Yeah? More open? More functional? More coordinated? Yeah? More coordinated. Okay. Okay, so now we're going to go over the flexors. Okay? So the flexors. Okay, so we need to extend the elbow, dorsal flexion of the wrist. Okay, and so we're going to start from the tip of the finger. Yeah. Okay, so there's a little bit of sweating. Okay. Okay, so let's just change. Running. Okay, so we need to put the arm into this position, dorsal flexion, correctly aligned. It's not like this, not like this. It is correctly aligned like this. And to apply the tape, covering the flexors. Okay. 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 Even the index finger is starting to change. Huh? Okay, so we have some sticking problems. Okay. Okay, so there are two ways of applying the tape. Yeah. One from the tip of the finger or one from the base of the first joint. What is the difference between applying the tape here or here? What's the difference with a patient with a functional problem or more of acute CP problem? We have spasticity or we have functional difficulty. So if you have lots of spasticity, you try and start from the tip. If you have functional difficulty, which means the child has difficulty in writing and drawing and eating in coordination, the proprioception of thumb and index finger, you apply the tape from here. So you leave the pad of the finger open. Okay? Okay. Extension. Okay. Extension. Make sure there's no tension. Yeah. Okay, next one. Okay, already in extension. Okay, just very delicately apply the tape, making sure that there is the distance between one tape and another. Okay? Okay, once you get to the fifth finger, the position is dorsal flexion, ulnar deviation or radial deviation? Radial deviation. Who said that? Very good. Okay. Okay, so we have some adhesion problems. Okay. Once we get to the thumb, okay, We're going to use this maneuver like this, okay? So you're going to apply the tape over the lateral border of the thumb and then changing the direction as you go. Okay. Okay, the activation is like this. Activation, activation, activation. Okay. Okay. Okay, so just do some movements again. Okay. So now clench this. This one is even more clenched. Yeah. Open, more open, more open. Yeah. And now we expect to have more coordination. Okay. Okay. So what are we going to use this treatment for? Piano. Eh? Piano playing. Very good. Okay. Because when you play piano, or when you learn to play piano, you're going to have very short fingers or very long fingers. Long fingers and wide fingers. Okay. So if you want to improve your piano playing, you apply this before or during? Even during. Even during. Okay. Okay. So in a pathological condition, what are we going to use this for? More pathological condition. If you want to learn piano playing and you have short fingers and lots of rigidity, you're going to get tendonitis. So how do you treat tendonitis? On the extensors. You have an extensor cyst. How do you treat a cyst on your extensor on your fourth finger? You create decompression, you improve the drainage. What else can we use this for? Okay, spasticity, rigidity, after elbow fracture, elbow operation, okay? And so consequently you have scar, and the scar always creates compression or decompression. Compression, and so consequently extensors go into rigidity, okay? So we treat the cause, compression, decompression, decompression, and the extensors, elongation. Okay, just like this. Okay, so for CP, for stroke, this is a fundamental. You're going to be using this on every patient. Together with what treatment? This is, we have bottom-up concept, yeah? Bottom-up concept. We do treatment bottom-up, yeah? Physical therapy is about that. So, we do a stroke treatment, this treatment plus occipital, okay, which we did yesterday. You always do these treatments together, okay, bottom and up. We can't put a tape here, okay. You need more oxygenation here. Yeah, you can see he needs more oxygenation, but we can't put the tape on the skull because the skull does not move. Okay, let's say it does not move. Okay, but we're going to get as close as up as possible, which means occipital. Okay. Okay, so I want you to do a practice of this. Okay, so I'll give you 25 minutes. Okay. So cut the tape together, make sure it is 1 centimeter wide. Okay? Always start on the index finger. Yeah. Okay, it's going to be the same method. Okay. So you're going to close the fingers to have reduced mobility, cause a fracture. Ah, really? Okay, so in that case, this is the maximum flexion, let's say. So you're going to apply the tape and then you get the tape and give it this hand. The patient is going to stretch the skin up, stretch, and you apply the tape. Otherwise, if the person has normal flexion, stretch the skin, see there's no more stretch. Whereas like this, you stretch, have more stretch. Okay? So you apply the tape, the skin stretch. Whether it is active or passive. Same thing. Okay? Yeah, same thing. Dorsal and palmar have those. Okay? Yeah. Ah, yes. Yes, there is. Okay. I'll do that straight afterwards. Okay. Okay. Lower back is lower back. Okay. Nice glasses. We'll look at that afterwards. Okay. 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 Come down. Okay, so you do this application, you will see that the pain. Yeah. Okay, so there. Okay, touch it back. Okay, you left it on more. Still have it on? Okay, you can do this actually. Brachioradialis. You want to do it? Okay, so this is our objective. This is the muscle part. So we start with support, cover, finish afterwards. Okay? Okay. So what is the width of the tape? 5 centimeters? It's too big. Okay, too big. Because she says she has spasm. Okay, so what do you mean spasm? So we have muscle contraction. Okay, muscle contraction, which is limiting the blood circulation. So we're going to cut into 2.5, cut in half again. Okay. Okay. So, how do we apply? How do we apply? We put the muscle into stretch position. So how do we put the muscle into stretch position? External or internal rotation? Internal. Okay, just like that. Yeah. Elbow slight flexion. So we're going to apply the tape here, and we're just going to go over the muscles line over. Okay? And you're going to do it towards the scalp. Okay? Okay? And when you apply, you have to stretch the skin up like this. Okay? Okay? So, stretching the skin up. Okay? As you cover the muscle, don't let rock the finger and then take it. And then stick. Don't let go. And then rub on. Okay, very good. So the next one is going to be going over, a little bit more wider, and then converge. Okay, because the muscle is okay, use the same technique. Okay. Okay, so we're just going to practice application of the extensiveness like this. And then we... Yeah? Okay. You have back pain. 0 to 3 is more than okay. So you had spinal problems? Okay. No herniation. Okay, so it's just the posture going on to yeah, that's yeah, okay. Yeah. No, we're covering the brachioradialis. Okay, so that is fine. Okay, so we test and it goes like this. Okay, you see it's covering the muscle fiber. Okay, like this. So we're using this for muscle contraction over the brachioradialis. Okay. Okay, so let's do the extensors and flexors. Okay. Okay, so this is an exercise in cutting in 5 strips, exactly the same. Exactly the same. Also front, as you cut. This is a visual experience.
Phải không? Chọn cái gì?
You need to cut. Okay, you need to cut 8 millimeters. Okay, so we're going to cut this into 3 strips. Okay, so that's 8 millimeters. Okay, so we just need 2. Okay. Okay, so we need, because you see, just clench piece. Okay, just take the film, clench piece. Okay, and extend. Okay, just like that. Clench, open, clench, open, clench. Okay, you see how the finger is? It's going one on top of another. Okay, so like that. Extend, fully extend, and then clench fist, extend. Okay, so you have to document in a precise way. Okay, if you want to use the photograph as a evidence. Okay, so because she has the rigidity. Okay, after the fracture. Did you have a plaster casting?
I did K-wire. K-wire. And POP for
Okay. Okay, so just like that, turn around, clench fist again. So we just have to apply the tape over the finger in more correct position possible. Okay,
Right,
more correct position possible. Okay. Because the tape, we want the tape to guide the movement. Guide the movement, not block the movement, but guide the movement.
like more easy to control.
Okay, see, so we want to apply the tape to assist her in. We want it to be easier to control. Okay, so when we go like this, we just have to make sure it is correctly aligned. So, okay, 1 finger, 2 fingers, 3 fingers. Okay, counter tension. Okay, and then we're going. Okay, counter tension. Okay. Because we want to assist it in its correct flexion. Okay, close and extend. Close. Okay, extend. Close and extend. Close and extend. Okay, you have to guide the movement. Okay. Okay, we just need to keep them. Okay, because we have an exam over here, we just have to keep the sound down a little bit. Okay. 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 Open and close. Open and close. Yeah. Open and close. Okay. Okay, but it's easier for you to control. Okay, so we just need to apply it constantly for the next 10 days. 10 days, constantly, especially at night. Okay? Okay, so we just need to improve the quality of the tape.
You got it right.
Bio.
Got it.
Okay, so fist in fist, for extension, wrist flexion. Okay, hold back. Stop. And this one. Good. This one. Hold on. Okay. Easy. Not saying this is. Okay then. Okay. Fist in fist. Fist in fist. That's position. Okay, stop. Okay, so this is fist in the opposite side. Okay, so just think of this. Lift this one up until here. Okay. Very good. Keep on. No. Yeah. Okay. Okay. That's very good. Excellent. Okay, but this is like this. Okay. So when you apply it, it's going in a direction that extends.
Vicky.
Make sure it's in the opposite side. This side, you do it on this side. Okay? This one here. Okay. Really, when you hinge, okay, this side is softer than this side because the direction is okay, but the width of the tape is too big.
Okay, then how one down, how one ini kena
Relax. Just Yeah, okay.
Siya. Bisa. Yang dia tulis di sini.
Okay, so just feel one side, the other side.
Miếng của tao bị hoài đi. Nó sống á.
Okay. Okay. Okay, so one second. Triple flexion. Triple flexion. So we're going over the extension of the tummy, which is in this
Cacing.
So because she has a very small wrist. Yeah. So okay. So means we just have to. Yeah, just a little bit more. Yeah, just try it. Okay.
Tadi nak garing tu je. Tak kena skin dia kan.
Go. I think the reason you don't give. Oh, really? We can just do that. Đó.
Đây, đấy, biểu diễn. 讲话小心一点啊，被人告。cái từ biệt ở về qua về có
Got break.
Oh, got break.
That's why I say us doing a break.
No, tell me ask the day, don't need ask.
Huh?
nào
No, what time?
zoom in
4 minutes.
你的 break 的吗
10, 15.
Hả? Bên cái này không? Bên cái này.
hả con
SM.
Okay. So. Okay. Okay, just continue. Okay, the problem is this part here. Okay, so just have to pull this one back. Sorry. Okay, now put your finger here and stretch in that direction. Stretch, stretch, stretch. And I get the freeze and I stretch. Okay. So you did really well because
我是这样，我是这样，我这边。我们打球。
Bono people. That's why they can go deeper.
Also Bono people, you know.
That's why can go.
Oh. You got live, you know.
Oh fuck. Can we off the live for a while? 10-15 we rest. It's Kumala. Should we have a refreshment at 10:50? Then after that we start back at 10:30. Right. Because he also didn't have any breakfast. Right? Yeah, go ahead. Then 15 then. Attention guys, we're gonna have our refreshment break at 10:15. Then we will start our workshop back at 10:30. Okay? During the refreshment, I would like to ask for your cooperation to be really silent. Okay? Thank you. Master special and also what Dasawan. Master techniques and master special. Upper track. Is two ways. You do compression, you get restrictive. You do non-decompression, you got relaxing. Concentric, eccentric.